Right, here's a story that, the content thereof was common sense to me, but it seemed to take a while to get the people that matter to acknowledge it as common sense. This issue, the health department has been in negotiations with Eskom to exempt some of the public hospitals from the ongoing blackouts. Common sense. Well, Eskom is currently implementing stage 2 blackouts and says the continued power cuts are mainly due to the high levels of breakdowns and the limited emergency generation reserves. So how far are the negotiations and how many facilities are exempt from blackouts? Let's hear now from the spokesperson of the Health Department, Foster Mohale, who joins us now for an update. As I say, Foster, I don't know whether this was initiated by the petition that I signed. I was one of the people who signed it, along with many thousands of other South Africans, because to me it just didn't make sense that this idea it didn't come naturally, that hospitals should be exempt from load shedding, blackouts from Eskom. Just tell me how far that project is and your negotiations with Eskom to get hospitals exempted.
Thank you, Tulasizo, and thanks for this opportunity. Greetings to the viewers of eNCA. And also, let me thank you for all the efforts that you have put in order to join all the organizations and individuals who have called for the exemption or exclusion of health facilities from load shedding. As you know, the impact of load shedding on health facilities, because we are dealing with the lives of our people. Yes, we've been engaged with the Eskom in order to implement the exemption of what we call the priority facilities across the country. We had about 213 across the country that we have submitted to Eskom in order to exempt. But it's not as easy as people will think, because when the Eskom, they've done what we call the configuration or electrifying of electricities, they did not foresee that one day we are going to experience the issue of load shedding, where we'll have to single out certain areas from load shedding in order to ensure that the electricity supply is not disrupted. But what we can report so far is that out of 213 hospitals that were submitted to Eskom, about almost just below eight of them have been exempted. So and it's a work in progress. We are working well with Eskom and municipalities.
Yeah. Did you say the number is at 88 now?
The number is just around 80, just I think 79, 78 of hospitals that have been exempted. But also we need to indicate that not all the hospitals that we have submitted or that have been electrified in the country, they received electricity directly from Eskom. Others, they received directly from municipalities. So Eskom has done its own part and is continuing to do that. So now we're also working with the local government to assist to fast track the exemption of facilities that receive electricity directly from municipalities. So that's why we embarked on 3 parallel processes. So the first one is Eskom continuously try to find ways to exempt those who are embedded in the network. Embedded means that find that one hospital is located right in the middle of a community where it is not easy to single out the hospital from the rest of the community. So they are doing their level best to do that. They've also conducted what they call the preliminary study, where they identified about 45 hospitals that for them to be exempted, we will require to reconfigure the current electricity configuration at the cost of about 179 million.
Is it, and I don't know, maybe I'm being simplistic here, Foster. To me, it seems that because you say that the way that the grid was set up and the connection was done all those years ago didn't take into consideration that there might be a day where you might want to single out this one facility out of an entire community. Has anyone looked at the option of saying where the hospital cannot objectively be singled out and left switched on while the rest of the community around it is switched off during the blackouts? Well, then let's leave the entire community with electricity and exempt them from load shedding.
Yeah, look, that was another option, but that it means now is going to defeat the purpose of Eskom of trying to reserve the electricity from one place to another. Then it means if the Eskom, for example, if about let's say 50 hospitals around Tshwane are embedded in the communities, it means the entire community or the district of Tshwane is not going to be load shedded, meaning that the Eskom is not going to achieve its objective of trying to save electricity. But as we indicated that we have embarked on a parallel processes. One of the processes that we are working closely with the CSIR in order to conduct a case study on how we can implement and roll out the solar panels at the critical hospitals. So that is the work underway. At any time, the CSIR will present their findings on how we can be able to roll out the issue of solar panel. As you know, that the issue of installing the solar panel is not just about the issue, but also the maintenance is also very important, because we don't want to embark on a process that later is going to fail. So hence, we're saying we are working on a number of options in order to ensure that at the end of the day, we are not going to lose even a single life precisely because of load shedding.
So what's your honest assessment then, Foster, from observing these conversations between yourselves and Eskom and the other entities that supply electricity? Is there a path that takes us to a situation where all of these 200-odd hospital facilities are exempt from load shedding, and that takes us to that destination within the coming few months? Or realistically, are we looking at something that's more long-term in the sense of either the solar panels project you are talking about with CSIR reaching implementation stage that's fruitful, or the reconfiguration that Eskom is telling you needs to happen in some instances, which may not be a short-term intervention that leads to us having the lights on all the time as they should be at a hospital?
Yeah, the good thing is that we are working closely with Eskom, and there's a high level of transparency in any activity that they've embarked on. As I indicated that for Eskom, they've conducted an analysis on about 45 hospitals across the country. They said for those hospitals to be exempted, it means they have to restructure the current network, meaning that they need to buy new the cables, they need to buy transformers, meaning that is going to cost about 179 million, of which is the amount that we don't have currently as the Department of Health. We still need to work closely with the Treasury in order to see how can we find that money in order to ensure that those 49 hospitals they can be exempted. So, but also what we are doing as the Department of Health, we continuously work with the National Treasury and provincial treasuries in order to ensure that we supply those facilities with enough energy in budget in order to ensure that they continuously maintain the current generators that they have. They're continuously able to afford the energy in terms of diesel. As you know, that the price of diesel is fluctuating from time to time. So we ensure that despite the challenges that we're having, the delays that we're having in order to exempt all the hospitals, but we'll ensure that we supply them with enough budget to ensure that the generators that we have currently, they'll continue to run and supply electricity in the critical areas like your ICU, maternity wards, and the likes.
So quick 2 points of clarity then, Foster. In relation to the 49 facilities where it seems reconfiguration of the connection and the network might be needed, I hear you mention National Treasury. Are you confirming that this is the path you are going in with the 179 million rand that will be needed, that's the direction you are going to try and plead the case with Treasury to say, one way or another, we've got to find a solution and have funds available for this project?
Yeah, definitely. It's not, as I indicated, it's national and provincial treasuries, because some of these hospitals, they fall under the provincial treasuries. They've got a role to ensure that we preserve the lives of our people. So yes, indeed, we work closely with both national treasury and the provincial treasuries, especially as I want to also emphasize that almost all the provinces and the hospitals, they exhausted their budget for fuel and maintenance of generators a long time ago. So we have communicated with Treasury to say, here's the problem. We need to shift the money from one item to another item in order to ensure that we support these hospitals and the provinces with enough budget to buy electricity, so that come the time of auditing, at least all the money, all the work that has been done can be accounted for. Because as you know that there is an element of corruption, so we need to work closely with the National Treasury in order to ensure that whatever decision, whatever proposal that we have, we first bounce it with the National Treasury for concurrence.
So you preempt in that answer my last question to you, which has to do with the backup generators, that I would have thought that all these hospitals and clinics actually have backup generators and receive fuel quite regularly. But you've just said now that many of them have long exhausted their budgets. How did that come about? Is it a case of not planning realistically how much you are likely to spend on maintaining generators, running generators, and purchasing fuel in a situation where realistically we are facing these power cuts from Eskom? Could it not have been planned better by the various provincial treasuries, provincial departments of health, and other stakeholders, yourselves included, to say, we can't under budget. This is our reality. This is what we are facing. We are going to need to run generators.
Yeah, look, yeah, definitely. I don't think there's any sector, there's anyone who could predict or prophesy that at one day with this load shedding will go up to level stage 6 of load shedding, which is very disruptive in nature, meaning that the generators which means that the generators are going to run for a longer time instead of, for example, we are used to about stage 1 or 2, where we can only be able to, generators can only be able to run for about a maximum of 2 hours per day. But once you go to higher stages of load shedding, it means that the period of blackout also is going to increase, meaning that you need to spend more on fuel, also the maintenance of these generators, because where they were not designed to supply energy or electricity for a longer time, but they were designed to as an emergency situation where there's a challenge of electricity cut or the issue of Eskom fixing the electricity. But now that we've seen identified that the issue of load shedding is a serious problem, it's bigger than what we thought, because at the beginning of financial year, we were still at about level 1, level 2, but as the year progressed, we see ourselves at level 6, level 5, which is something that we did not predict for. But this is we've learned a lesson, and so we work closely with Treasury to ensure that we don't want to fail our people. We don't want to lose lives precisely because of load shedding. We'll do everything possible.
Fair enough. All right, I've got to thank you for that. Foster Mohale speaks on behalf of the National Department of Health there. There you have it. You can't have these generators turning to become baseload energy supply for these facilities. They were always meant to be a backup, temporarily switched on once or twice every now and then when electricity is not there. But these days, we're running them as baseload, and this is the result.